Hello, I'm Brayton Shirley with the Steadman Hawkins Clinic of the Carolinas and Greenville Hospital System. I want to take a few moments to talk with you about discharge instructions following hip and knee replacement surgery. First of all, I want to congratulate you guys for getting through often the hardest and toughest part of your recovery, which is the first few days in the hospital. A lot of your difficulty is behind you, and we aim to ease your transition either to home or another facility. More specifically, I'm going to talk about how we manage our patients at home. We will arrange home health care for you, and our home health agency nurses and therapists usually will come to the house in about 48 hours from your discharge. And their responsibility will be to handle your dressing changes, to check blood work for those of you on Coumadin, and to help with exercises following your hip and knee replacement. We typically expect the home health nursing and therapy to come to the house about 3 days a week, and they'll usually spend about 3 to 4 weeks coming to the house. And it does depend on your progress and safety and success in your recovery. When you go home, we like you to initially use either 2 crutches or a walker, and the point of this is to keep you from falling or injuring yourself. That's often the most catastrophic event that can happen after you leave the hospital, and we see a lot more safety if you have something in 2 hands like a walker or crutches. Now, the next point I want to talk about is swelling, and swelling is really your enemy, and this is very important for those of you who have had knee replacement. We see tremendous amounts of swelling, and we need to do lots of things to combat swelling. If swelling persists, we often run into difficulty with excessive pain, stiffness, and even wound healing complications that could lead to infection. And so we'll battle swelling by encouraging you to elevate your leg as much as you can, and elevation means your toes should be above your nose. So we want a significant elevation, placing your foot really above your heart, and this allows the fluid to drain downhill. We'll use what we call TED hose, and many of you have had these in the hospital. The TED hose is really important for about the first 2 weeks, and we use these even in hip replacement patients. I think it's most important to have the TED hose or the compression stocking on the operative extremity, and it doesn't necessarily need to be on the non-operative extremity if that extremity is not swollen. Some of you will even need an ACE wrap, which can provide even more compression to aid in reducing swelling and promoting healing. You'll find as swelling goes down, the range of motion improves and pain improves, and your success often is greater. In addition, when in the home setting, we'll have wound care provided for you by your home nurse, and they will provide Tegaderm dressings, which are clear cellophane-looking dressings that will allow each of you to shower as long as that dressing is in place. And we'll encourage you to allow the home nurse to handle the dressing changes, and we want anybody going near your incision to have gloved hands and use very sterile technique so that we can prevent contamination of the incision. I want to talk next about Coumadin, and most of my patients will be discharged on Coumadin. There are some alternative blood thinning strategies such as aspirin and injectable types of blood thinners. Most of my patients will be discharged on Coumadin, and we'll use this for 3 to 4 weeks. Your home nurse will monitor Coumadin for us. This usually involves twice a week blood draws, and we often need to adjust the dose of the Coumadin based on your diet. And a word on your diet, I think it is important to eat a balanced diet that's high in protein and fruits and vegetables. Many nurses and some of the literature concerning Coumadin suggests that you should not eat leafy green vegetables. It's my opinion that you should eat a balanced diet, and we will adjust your Coumadin as necessary to bring the levels up appropriately. Next topic we'll talk about is pain medicine, and pain medicines will be provided for each and every one of you. We want you to have as little pain as possible, but nothing is free. And what I mean by that is pain medicines can often lead to difficulty for some of you. So I think pain medicines will help you achieve better motion and better mobility. To a certain extent, it can help many of you sleep better at night, but at times pain medicines will cause complications such as nausea and in particular constipation, and so we need to be very mindful of that. As soon as possible, it is advisable to transition over to Tylenol if possible. In addition, for those who aren't allergic, we will even use medicines such as Celebrex as another way to combat your pain. I want to mention again constipation, and constipation is a very big problem for just about any type of major surgery. Anesthesia in and of itself causes constipation. The dehydration that you encounter during surgery leads to constipation, and most, particularly the pain medicines that you take in and out of the hospital, often cause constipation, and so we need to battle this aggressively. I will send each of you home with Colace, which is a stool softener, and then I encourage you to do more whenever necessary, and so we have alternative medicines that will stimulate the colon, such as Synacot or X-Lax and even Dulcolax. And as a last resort, we'll use even an enema if necessary. I strongly encourage you to call my office if you are having a significant problem with constipation, as this is a very serious condition that can even require readmission to the hospital. Also want to encourage each and every one of you to call our office with questions. We have great resources at our office, a lot of people who've had a lot of experience getting our patients through their early and later recoveries, and we can answer many questions and save you anxiety and worries. In addition, have given many of you a joint replacement handout prior to your surgery and encourage you to reference that joint replacement handout, which we'll talk about many of these issues I'm discussing with you now, and that will often keep you out of trouble and answer a lot of questions that might come up. We will see you back in the office in around 10 to 14 days from your surgery. It is usually at that time that we will remove sutures for those of you who have any sutures in place, and certainly we'll be carefully checking your incision for healing. And we look forward to your success following your hip and knee replacement. Good luck.